The protection of the wounded and sick in conflict and other situations of violence goes to the very heart of the creation of the Red Cross and Red Crescent movement, and of course remains one of the main tasks that we as a movement have in our humanitarian work today. In 2011, the ICRC, Red Cross and Red Crescent national societies came together with the Healthcare in Danger Project, a global initiative to bring an end to violence against healthcare. So when we speak about violence against healthcare, we're talking about direct attacks against healthcare personnel, against healthcare facilities. We're also talking about the obstruction of healthcare facilities. For example, an ambulance being wrongly held up or delayed at a checkpoint, and even the discrimination or certain types of violence against patients themselves. Almost 7 years after beginning the Healthcare in Danger project, tragically, we continue to see healthcare being attacked in countries affected by conflicts and countries affected by violence. In January, in 10 days, there were 10 attacks against hospitals in Syria. On the 20th of January, in southwestern Pakistan, a mother and her daughter, both polio workers, were murdered simply for the fact of being healthcare workers. And in Afghanistan, on the 27th of January, over 100 people were killed when an ambulance was loaded with explosives. It managed to pass through checkpoints, and the explosives were detonated in a very busy and central part of Kabul. So as well as the initial tragic incidents of violence against healthcare, whether it's the killing of a doctor or the bombing of a hospital, there are hidden costs. There is a hidden burden of attacks on healthcare. To take an example, since the beginning of the conflict in Yemen almost 3 years ago, there have been more than 180 attacks against hospitals and against healthcare services. By the end of 2017, more than 1 million people had been diagnosed with cholera. This is because the Yemeni healthcare system was on the verge of collapse. It could no longer respond to an otherwise preventable public health crisis. And a large part of the collapse of the Yemeni healthcare system is related to the direct attacks against healthcare and also certain policies that have restricted the entry of medical supplies into Yemen. So the first step to protecting healthcare in conflict is respecting international humanitarian law. There are extensive provisions in humanitarian law that protect the wounded and sick and that protect healthcare, and in order for healthcare to be protected, the combatants, the parties to the conflict, need to be aware of humanitarian law. So a large part of the efforts of the ICRC and Red Cross and Red Crescent national societies is to carry out awareness raising and training with warring parties to make them aware of their obligations to respect healthcare. The ICRC has worked on the issue of violence against healthcare from the very beginning with Red Cross and Red Crescent national societies, and the Australian Red Cross has been one of the leading national societies when it comes to advocating for an end to violence against healthcare and advancing specific measures, for example, carrying out a study on domestic Australian legislation and the protection of healthcare. And as these combined efforts of the ICRC, of the Australian Red Cross and of professional healthcare organisations, when combined together, they can have a real concrete impact on bringing an end to violence against healthcare.